Okay, good morning, good afternoon, good evening. This is Dr. Garais, BIO117. This is laboratory week 2. We're a little bit behind the curve due to technical difficulty. And this is our virtual reality. And today we will be doing GI and pulmonary. So let me position myself. Um, uh, Maybe move myself here. Okay, a little bit more centered. Here. Okay. Move my patient down here, this level. Alrighty. So now, again, I use the thumb button and put the square like in front of my patient. And we're gonna do the GI first, and I'm gonna use the trigger to activate it. That's your second digit, and you could use either one, right or left, right? So I'll click on that one. And now this is the GI stuff. And then of course I could bring it closer to me, right? Or I can again click on the button here, on the thumb button, bring me even closer. So we can now see we have our liver here, our esophagus here. We have our three glands. Let's bring this down a little. Maybe you can see, look here, these are our glands here. We have our parotids, submandibular, and of course sublingual, right? And of course the esophagus here. And let's move a little bit up so we can. Then we could see the liver, we could take it. Now, one of the questions were like, where are the quadrants? So remember, you gotta look at your patient. Let me draw a line, magical line here, right? This is middle, and of course, this is the right side of my patient, and this is the left. So we have the liver here, and then what I'm pointing right here is the falciform ligament. I press on the trigger, and I could move that out of the way, and then I could look around it. Maybe I can kind of bring it closer to me. Okay, and you could see, I think that's the gallbladder, or maybe it's still stuck up there, right? And I could turn it around, and move that other way. Esophagus, right? I could move that out of the way. Then we could look at this, the stomach is in pieces. So we could look at the top part. Let's bring this close. See the rugae and the folds, and it's layers of muscle. Move that aside. And this is the body, or corpus, with a little bit of the cardiac here, part of it here. And you could see that right here is that circular muscle. And of course, that's your lower esophageal sphincter. And more of those white lines, those are rugae, those are the folds. And lower esophageal sphincter, also known as the cardiac. Okay. This is the pyloric. And let me bring this closer. Sorry if I'm a little bit wobbly, my tremors. You see all the way in there. Maybe I could turn it around. This is a neat thing about this versus an animal. See again, another circular muscle, and that's your pyloric sphincter, which then will go, let me adjust my eyes a little bit. Oh, right here we have our pancreas associated here with our duodenum. Okay, you can see the pancreas. There's the head, and then there's the tail. It's kind of cool. Duodenum, first part of your intestine. Then you could see the large intestines. You have your appendix here, cecum. Remember that band of connective tissue there, if you could see that there, that band right here, that's your tenia coli. You could see the outpocketings, they're nice and exaggerated here, and that's how you know these are large intestines. Ascending, transverse, descending, sigmoid, rectum, and then of course your anal sphincters here, and you have your external, internal. So let's go, and it goes, I know that this has to be my jejunum, this has to be my ileum, and then connected, ileum will connect right there to my cecum. And there's a little valve there, ileocecal valve. Maybe we can see it. Let's take it out. Take the cecum here, turn it. No, oh, there it is. Uh-oh. Clicked on the wrong thing. Bring this GI back. Okay, so we take these, that's the ileum, that's the jejunum, right? Let's take the descending colon, sigmoid, rectum, ascending, appendix, cecum, transverse. Let's get that all out of the way. It goes in, you have the stomach and the duodenum. Oh, and the stomach and duodenum, right? And let's put it all back. Ooh, I forgot we could tilt stuff. You can see the back side of it. Take it and look at the pancreas. Let's see if I could tilt it. Let's see if I can bring myself closer. There you go. Okay, right? And you can see, and it's upside down. So let's tilt it right side up. Kinda. Okay, it's kinda tilting. Okay, all right. I'm getting dizzy. All right. Again, another view, right? You have your esophagus. Right here will be your lower esophageal sphincter, also known as your cardiac sphincter. Here's the cardiac section of your stomach. Lesser curvature, greater curvatures on the outside, and cardiac section. And this is your fundus all the way at the top, the corpus or body. Then you have your pyloric sphincter here, and then your duodenum. And you saw how your pancreas fit nicely somehow in here. And gallbladder as well. They all connect. And then I could press the A button or whatever button that was, and then I can have it all back. And then maybe I can pull myself a little bit away from it. Maybe pull back a little bit. Okay? Neat, right? And of course, we didn't really talk about it, but in future clinical training, we're going to talk about the quadrants. Essentially, you can look at your patient like this. Let's bring the whole person back. Let's bring her all back. And that's to bring everybody back. So you can do imaginary line here, the midline, and then here. So the liver would be right upper quadrant, stomach would be left upper quadrant. Remember, this is her left side. And this would be the left lower quadrant, or LLQ, left upper quadrant, LUQ, right upper quadrant, RUQ, right lower quadrant, RLQ. That's one way to look at it. That's the quick and dirty way for it. But there's another way that's 9 boxes that is a little bit more precise. You have one box here is your umbilical. Then you have another box or another section up here, and that is your epigastric. Epi means on top of. And then you have your hypochondriac left, hypochondriac right, lumbar left, lumbar right, inguinal left, inguinal right, and if that's the epigastric, this is the umbilical, this has to be the hypogastric area. And you can see 9 boxes as opposed to just 4 simple right upper quadrant, left upper quadrant, so on and so forth. Let's look at her lungs. You have that, and let's bring it down a little bit because I am looking too high. So you could see the oropharynx. Well, let's turn this thing. trying to be a little bit. Okay. So you can see, of course, there's dentition and things like that. And then you have your trachea. And where's my trachea? You took your trachea out. Let me hit this again. Okay, I guess the trachea is missing. Or maybe if I add bones? No? Oh. Well, when you look at this, the main things that they wanted you to see, of course, let's bring this thing lower and closer. Okay, so when you're looking at it, right, let's move this out of the way, and that's, of course, your lung parenchyma. And I don't know why this doubled up. Oh, okay. Well, you could see you have, oh, there it is. Guess it's glitched out a little. You have your trachea, of course, and then to your carina and your right left mainstem bronchus. This area right here is called your hilum, right? Where everything connects. And you can see how the bronchial tree, they call it a tree because it kind of looks like a tree. You have your left mainstem bronchus, which is more horizontal than your right, and it's a little bit longer. And if you'll notice that, this is your right mainstem. Let's bring this all out here. And if you notice, you look at it, the cartilage only goes so long, and then it gets replaced by smooth muscle. If you look at the right, let's move these out of the way. If you look at the right lung, you have these demarcations here. So this is your lower lobe, middle lobe, or inferior, middle, superior. But if you look at, whoa, whoa. If you look at this one, I don't know why this was doubled up, but it is. You can see how there's only an upper part and a lower part. You see how it's demarcated that way, right? And, oops. See, upper part and lower part only for the left lung. And you see the other side here. Look at that, a nice cardiac notch. Let's bring it all back together again. So, cardiac notch, upper lobe, lower lobe of your patient's left lung, and you have superior, middle, and inferior on the right lung as well. Okay, that concludes the little preview and all this stuff. And of course, when you want to leave, you hit exit, right? I'm just curious about, since I'm here, let's look at some of these pathologies. Thrush and Candida albicans. So they show what it looks like 3D on a microscope. Let's look at pinworm. Oh, that's nasty. Okay, thrush. How do I get my... Oh, okay, let's look. See how there's a discoloration of my patient's tongue and of the tonsils. Thrush is, you see this word here, Candida albicans. The first part, it's like the family name is capitalized. Albi or albino means white. And Candida is a family of, not bacteria, oh gosh, I'm having another senior moment. It's not bacteria, it's what? Yeast. Took me more than a minute, right? Because my patient here is probably immunocompromised, and remember, there's like 249 things that could grow in there, and that's kind of cool. Let's look at colon CA. You see that colon CA and it starts to spread? You can see that. And remember, the cutoff is like 2 2 centimeters. This is really weird. Since I'm getting closer to this thing, memory is making me smell it. That's strange. Hey, here are both my hands. Why was my other hand? Oh, I was clicking on something else. Put both of these things in my hand. Let's look at some other pathologies. Let's look at some lung pathologies. Pneumonia. Oh, you see a pneumonia? You see all, this is your terminal, terminal bronchiole, and of course you have these, they're red and blue, so these are your pulmonary capillaries, and you can see all the fluid and mucus is gumming up, and it won't be able to have gas exchange. That's kind of cool. Tuberculosis is a bunch of tubes, hence the term tuberculosis. COPD, which is chronic obstructive pulmonary disease, and you could see what will it do. And part of COPD used to be asthma, bronchitis, but the big thing about asthma and bronchitis is the mucus. And you could see, even though you don't have asthma, you could have bronchitis, you could have wheezing, right? And of course, you know, you don't have any cartilage to keep this stuff open anymore. So you only have smooth muscle here. It's kind of cool. Let's look at some GI. Did we look at some GI disturbances? Let's see. Let's look at some GI disturbances. Yeah, we looked at some GI disturbances. Let's look at some heart problems. Let's look at a coronary artery. Ooh, whoa, big, right? So let's back the fudge up. Ooh. So this is really nice. You see the coronary arteries here. And when I'm looking at this, this looks like my LAD, my left anterior descending, and it's in a groove called your anterior interventricular sulcus. So this is, of course, you know, this is your aorta, and this is your pulmonary trunk. This has to be your right ventricle. So this is the right ventricle, right side of my patient. This has to be the left, apex, base. You have your, oopsies. Go back to corner. I gotta watch where I'm pointing my swords here. So we can go around, and remember this is your atria, and the little flap is called auricle. But let's look at the backside. Remember, you can now figure out any model. Remember we talked about this has to be the left atrium, this has to be left ventricle. Left atrium branches out into these pulmonary veins, oxygenated, coming back from the lung. This is my pulmonary trunk. That's got to be my pulmonary artery, and it goes where? One goes to the left, the other one goes to the right. Look how thick my aorta is versus versus my oh, they made it the same thickness. It's a little bit accurate. Note to the people, but coronary artery disease, you could see, like this is so big, it's so easy. These are not even, these big parts right here, not even a millimeter wide. Heart prolapse, fossa vallis, sickle cell. Ooh, what's going on here? Oh. Interesting. So we all know those red blood cells, but you can see what sickle cell does. You know, those banana shaped? It's gonna gum up things. And especially when you go into the spleen. So this is normal, right? You have your biconcave disc, hemoglobin in the middle. You could see this, it's like this got folded in half and turned into like some sort of hot dog but it looks like a sickle to whoever. This is neat. So many wicked cool stuff here. What else did we do? We did brain before, so let's look at some other brain stuff. Meningitis, yada, 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 yada. Let's look at a neuron. Oh. Right, you have your terminal bud here, and this is your body, and then these are your dendrites, picks it up, and then the electricity goes through here, and then it turns into chemical over here. I find it funny you can't do the middle finger. Okay, this goes down. Yeah. Yay! How silly are we? Pretty much. You got it. Meningitis, viral. Oh, I don't know how we're gonna see meningitis viral. I guess we have to take off some, I don't know. Just work here. Skin problems, ischemia. How are you gonna do ischemia? Oh. Remember we talked about gangrene? Look at that. Look at that. That's pretty bad. Ooh, I don't want to be that close. Do you see all this dark stuff and this stuff right here? All this dark stuff right here? That's Eschar, that's necrosis. And you see now the inflammation is going through the live cells and it will spread. Probably diabetic, and this is what it looks like. Okay, let me put my patient back to normal. Right, and that's a female version. See, what this is neat. Oh, look. Let's not see general warts, shall we? Neoplasm, necrotizing fasciitis. And again, necrotizing, necrosis. You see these dark spots? Ooh. Well, I digress. This is really cool, but we gotta go and go study for our exam. See you guys in lab.